For the remainder of the presentation, we will be discussing strategies for responding to phases of the acting out cycle. Remember that even if everything goes perfectly, you'll still have students that escalate. In phase 1, calm, the student is cooperative and behavior is acceptable. Typically, the behaviors that you see will be that the student accepts corrective feedback, they follow directives, they can set personal goals, they ignore distractions, accept praise, and typically on task. Obviously, we would like to have all students in the calm phase all the time in the classroom. However, that's not realistic, and we need to prepare for behavior escalation. Sometimes, even typically well-behaved students may escalate because of emotional disruptions in their life. Obvious, we would like to have all students in the calm phase all the time in the classroom. However, that's not realistic, and we need to prepare for behavior escalation. Sometimes, even typically well-behaved students may escalate because of emotional disruptions in their life. During the calm phase, the intervention is focused on proactive interventions. We want to focus on instruction and positive behavior supports. The ways that we can do that is to arrange for high rates of successful academic and social engagements, use positive reinforcement, teach social skills, and communicate positive expectations. And we do that by providing classroom structure, providing quality instruction, managing attention, and teaching behaviors in the same way we teach academic skills. For a student to remain in the calm phase, proactive strategies need to be in place. Some of those strategies include providing classroom structure, providing quality instruction, managing attention, teaching behaviors in the same way that you teach academic skills. Different students may have very different triggers. The trigger is phase 2, also called antecedents. It could include things like a conflict or failure, demands placed on the student, changes in a routine, pressure, ineffective problem-solving skills. Maybe they are facing a correction procedure, or it could even be things that we're not aware of that are non-school-based triggers. In the trigger phase, the intervention is focused on prevention and on redirection. Ways that we can focus on prevention and redirection are to increase opportunities for success. One way is to provide pre-corrections, and I'll be speaking about that in detail a little more in just a minute. You can respond to students exhibiting expected behavior. Catch other students when they're being good. Reinforce the student's first on-task response. As soon as you see that first on-task response, recognize it, reinforce it. Intermittently reinforce on-task behavior, meaning not every time, but sometimes you reinforce it and sometimes you don't. That strengthens that behavior. And look for the pattern of the behavior. And you can also look for programs or services to help address the non-school-based triggers. Pre-correcting is an antecedent strategy you can use to tell and remind students of behavior expectations before potential behavior problems occur. A pre-correction tells students how to approach a new task or situation. When you deliver a pre-correction, You identify what may be challenging and explicitly teach the correct responses using action-oriented language. For example, if you're going to the first school assembly of the year, you might say, I know this is our first assembly. We're going to be active listeners during the presentation by staying quiet when the speaker is talking. When students are agitated, they will have difficulty processing what an adult says to them. This is not the time to teach a behavior. We teach behaviors at the calm state. Phase 3, agitation. Overall, the behavior is unfocused and distracted, often due to an inability to handle the triggers. The behavior that you see may include off-task behavior. They may be questioning and arguing, out of their seat, bothering others, or experiencing social withdrawal. When students are agitated, they will have difficulty processing what an adult says to them. This is not the time to teach a behavior. Remember, teaching the behavior occurs at the calm stage. During the agitation phase, the intervention is focused on reducing anxiety. Avoid escalation responses. Try to use empathy. If it's not addressed, if the behavior is not addressed, the student may escalate or remain distracted, making instruction difficult. Provide reasonable options and choices, and involve the student in successful engagement. And a strategy that you can use for that is behavior momentum. Remember that you need to plan ahead of time how you will provide these responses, or you may not be able to be empathetic. It can be easy to respond to agitation in a way that escalates the situation if you don't plan ahead. During the acceleration phase, overall the behavior is staff engaging and oftentimes leading to further negative interactions. At this point, we often feel obligated to respond, and the student may be getting zeroed in on something or someone. The behaviors that you see may include questioning, arguing, and threats, noncompliance and defiance, provocation of others, and or rule violations. So how do you address noncompliance and defiance? These are some general guidelines. Teach what the student is to do and be clear about what the student is to do. Provide reminders, especially at times when noncompliance is predictable. Have a standard consequence or sequence and teach it. Acknowledge the students who are on task and who are complying. Speak to the student quietly rather than in front of the entire group. Allow them a chance to save face. Provide a single specific direction. Stay with the direction and use the broken record method. Acknowledge when the student is being cooperative or follow through with the consequence. Continue to acknowledge other on-task students. At the acceleration phase, the student will try to engage staff. Response may escalate the behavior. The response from the staff may escalate the behavior. And it's important that as the student becomes more angry or more upset, that you become calmer and more detached. Remember, the student is using this behavior to try to obtain something or escape something. Try not to take the behavior personally. So the intervention should be focused on safety. Remove all triggering factors, avoid escalating prompts, maintain calmness, respect, and detachment, approach the student in a non-threatening manner, utilize non-confrontational limit setting procedures, and most of all, remember, this is the last opportunity to avoid peak behavior. Techniques to avoid during acceleration include holding a grudge, raising your voice or yelling, nagging, drawing unrelated persons into the conflict, preaching, using sarcasm, making assumptions, bringing up unrelated events, making comparisons with siblings or other students, insisting you're right, insisting on having the last word, or attacking the student's character